Hello everyone, my name is Sumit. I am back with the new video. Today we will discuss about the RBC WBC platelets and clotting factor disorder. In that first one, red blood cell disorder, also known as erythrocyte disorder, are the condition that affects the structure, function or production of red blood cells, that is RBCs. Some common example of RBC disorder include, in that first one is anemia. This is the condition characterized by a lower than normal number of red blood cells or a lower amount of hemoglobin in the blood. It can be caused by the various factors including nutritional deficiencies, chronic diseases and the genetic factors. Symptoms include the fatigue, weakness, pale skin, shortness of breath, dizziness, cold hands and as well as fever. We will talk about the treatment. Treatment depends on the underlying cause, but it may include iron supplements, dietary changes, addressing any underlying health condition, and in a severe cases, blood transfusion. The next disease is sickle cell disease. It is a genetic disorder that causes red blood cells to become a mishappen and break down more easily. This can lead to pain, organ damage and an increase the risk of infection. Symptoms include the pain episode, that is crisis, fatigue, jaundice, frequent infection, delayed growth, vision problem. Then next is treatment, pain management during the crisis, medication to prevent complication, blood transfusion, bone marrow transplant in severe cases. Then next disease is thalassemia, a group of genetic disorder that result in decreased production of hemoglobin and red blood cells. There are various types of severities of thalassemia. Symptoms include fatigue, weakness, pale skin, slow growth, jaundice, bone deformities in severe cases. Then we will talk about the treatment, blood transfusion, iron chelation therapies to manage the iron overload, bone marrow transplant in some cases. Then next disease is polycythemia, a condition in which the body produces too many red blood cells. This can lead to thicker blood and increase in the risk of clotting. Symptoms include fatigue, headache, dizziness, enlarged spleen, itching, redness of skin. Treatment, removal of blood, medication to reduce red blood cell production, addressing underlying the cause. The next disease is hereditary spherocytosis, a genetic disorder that can cause red blood cells to be abnormally shaped, leading to their destruction and anemia. Symptoms, anemia, jaundice and enlarge of spleen. Treatment, folic acid supplement, blood transfusion and in some cases removal of the spleen, that is splenectomy. The next disease is G6PD, that is glucose 6 phosphate deficiency, in inherited enzyme deficiency that can lead to the destruction of the red blood cells when exposed to the certain triggers such as certain foods and medication. Symptoms simply include jaundice, fatigue, pale skin, dark urine and abdominal pain. Treatment, avoiding the triggers, certain foods, medication, supportive care during the episode, maintaining a healthy lifestyle. The next disease is autoimmune hemolytic anemia. In this condition, the immune system mistakenly attacks and destroys its red blood cells, leading to anemia. Symptoms, fatigue, pale skin, jaundice, dark urine. Treatment, corticosteroids and other immunosuppressive medication, blood transfusion, treating underlying condition. This next disease is paroxysmal nocturnal hemoglobinuria, that is PNH, a rare acquired disorder where red blood cells are susceptible to destruction, leading to anemia and other complications. Symptoms include hemoglobinuria, dark color urine, fatigue, abdominal pain, difficulty swallowing. Treatment, uclinazumab, a medication that helps to prevent the destruction of red blood cells, bone marrow and transplant in some cases. Then next we will talk about the WBC disorder. In that first one is leukemia. Leukemia is a type of cancer that affects the bone marrow and blood. It leads to the overproduction of abnormal white cells, crowding or healthy cells. The symptoms include fatigue, weakness, frequent infection, fever, easy brushing or bleeding, swallow, lymph nodes. Treatment include chemotherapy, radiation therapy, bone marrow, stem cells, transplantation, targeted therapy. The next disease, lymphoma. Lymphoma is a cancer that or originate in the lymphatic system, which include the lymph nodes, spleen, and the bone marrow. Symptoms: enlarged lymph nodes, fever, weight loss, night sweats, itching. Treatment: chemotherapy, radiation therapy, immunotherapy, targeted therapy, stem cell transplantation. The next disease is myelodysplastic syndrome, that is MDS. MDS are a group of disorder characterized by the dysfunctional bone marrow that produce poorly formed or immature blood cells. Symptoms: fatigue, weakness, anemia, easy brushing or bleeding, recurrent infection. Treatment: supportive care, blood transfusion, medication to stimulate blood cell production, bone marrow transplantation. Then next disease is granulocytosis. Granulocytosis is a condition where the body doesn't produce enough granulocyte, a type of white blood cells, leading to increase the susceptibility to infectious. Symptoms include high fever, sore throat, mouth ulcer, severe infection. Treatment: identifying and removal the underlying cause, antibiotics, growth factors, supportive care. Then fifth disease is chronic granulomatosis disease. CGD is a rare genetic disorder where the immune system phagocytes are unable to kill the certain types of bacteria and the fungi. Then next we will talk about the disorder of platelets. In that, first one is thrombocytopenia. Thrombocytopenia is a condition characterized by a low platelet count which can be lead to an increased risk of bleeding. Symptoms include easy brushing, or small red or purple spot on the skin can be happen, prolonged bleeding from cuts or injuries. Treatment the underlying cause, platelet transfusion, medication to stimulate platelet production. Then next disease is idiopathic thrombocytopenia purpura, that is ITP. ITP is an autoimmune disorder where the immune system mistakenly attacks and destroys the platelets. Symptoms: easy brushing, petechia, nosebleeds and bleeding gums. Treatment include the corticosteroids, immunoglobulins, medication that affect the immune systems, splenectomy in some cases. Then next disease is thrombocytosis. Thrombocytosis is a condition where the body produces too many platelets which can increase the risk of clotting. Symptoms often asymptomatic, but in some cases there may be blood clots, stroke or heart attack. Treatment including the treatment underlying the cause, medication and reduce the platelet production or function. Then next disease is Bernard-Soulier syndrome. This is a rare genetic disorder where the platelets lack certain proteins needed for a normal clotting. Symptoms including the brushing, easy brushing, bleeding from the gums and the nose, heavy menstruation period. Treatment: platelet transfusion, managing the bleeding episode, medication to the stimulate platelet production. Then next fifth one disease is Glanzmann thrombocytopenia. Glanzmann thrombocytopenia is an inherited disorder where the platelets lack of protein that's essential for the clotting formation. Symptoms including easy brushing, prolonged bleeding, nosebleeds, heavy menstruation periods. Treatment: managing bleeding episodes, platelet transfusion, avoiding medication that can be affect on the platelet function. The next disease is gray platelet syndrome. These are the rare genetic disorder caused by the platelets to have a gray appearance and function improperly. Symptoms including nosebleeds, bleeding and after surgeries. Treatment: managing the bleeding episodes, platelet transfusion, supportive care. Then next we will talk about the clotting disorders. In that, first one is that is hemophilia. In that system symptoms include the prolonged bleeding after injuries, easy brushing, joint pain or swelling, and in a severe cases spontaneous bleeding can be happen. Treatment: hemophilia is typically managed through regular infusion of clotting factor concentrate to replace the missing clotting factor. In some cases medication may be used to stimulate the body natural clotting processes. Then next disease is bone Weller-Brand disease. Symptoms include the easy brushing, frequent nose bleeds, prolonged bleeding after dental work or surgery. Heavy menstruation period can be happen in the females, and in severe cases, spontaneous bleeding will be happen. Treatment may be involve DDAVP, that is desmopressin, to increase the bone Willebrand factor levels. Then third one disease is thrombophilia. Symptoms include the thrombophilia, increase the risk of abnormal blood clot formation, which can lead to the deep vein thrombosis, that is DVP, DVT, pulmonary embolism, or the other clotting related issue. Treatment varies depending on the specific type of thrombophilia. It may be involve anticoagulant medications such as warfarin or never direct oral anticoagulants to prevent the blood clotting. Then next disease is factor V Leiden mutation. Symptoms increase risk of blood clots, often leading to deep vein thrombosis, pulmonary embolism. Treatment management usually involves anticoagulant medication to prevent the clot formation, especially during high risk situation. This is all about the WBC, RBC, platelets and clotting factor disorders. Thank you.